Hi, my name is Barbara Sinnott.
How did you hear about the St. John Clark Pain Treatment Center?
Well, I arrived here through a series of MD referrals. I began with a neurosurgeon who actually mentioned the neuromuscular therapy and sent me to a pain specialist who then sent me here first before any pain treatment.
How did you feel before and after your initial treatment at the St. John Clark Pain Treatment Center?
And the first appointment was eye-opening. It was, I was hearing different things than I had ever heard, because mostly any instruction I had about the spine was about the spine, the bone, and the spinal cord, of course, was just mentioned as something you shouldn't mess with. Then Randy was talking about muscles primarily and nerves, and his diagnosis, I brought an MRI with me, and then he did a physical exam. It centered on the psoas muscle. My spine was curved in the wrong places, the wrong way. If it was supposed to be curved one way, it was curved the other way. And it was, he assumed, muscle pulling it that way, so he explained that they would work on the muscles that were pulling it into the wrong positions, which were then affecting my posture, which was affecting the wrong position more and causing the pain.
How has neurosomatic therapy and the St. John Clark Pain Treatment Center improved your life?
I left kind of walking on air after a minor treatment, and then within 2 more treatments, the pain that I had been complaining about was not there. I was not free of pain, it just shifted to a different place. It has gradually ameliorated. A very exciting thing for me was that I was able to stand for an hour in the kitchen and cook. And I had not been able to stand for more than 15 or 20 minutes at a time in years. And that happened fairly early in the therapy. They found that one leg was considerably shorter than the other, and my torso twisted. They actually found amazing things about my body the first appointment, which I went home and demonstrated for my husband and friends to their point of boredom, I'm sure. But it was amazing, and it was visible. My one knee was 5 inches in front of the other knee when I stood, and I'd never noticed it, neither had they, but when you looked at it, it was outrageous. They gave me lifts for the shoes and a pelvic lift for when I'm sitting, which made it possible for me to sit at restaurants for lunch or dinner, which I had also not been able to do without slumping badly and having pain that I would have to take medicine for. I was very excited, because he thought that it was possible to prevent having surgery. One vertebrae was very messed up, and it was possible that I would have to have that operated on, but he hoped to alleviate the pain to the degree that I didn't feel the need for further treatment. And he was very, very knowledgeable, and I'm very, very snobby about that. He was obviously very intelligent, very well educated, and seemed to have a new field that I had not heard about. The neurosurgeon had mentioned to me that it was a new field, and everything about it was exciting. It was possibilities that I had never heard before.